Well, I am delighted to be joined by Raji Koppolu today, president of NAPNAP from 2019 to 2020. Raji, thank you so much for joining us.
Thank you so much for having me.
Well, I think to kick us off, I would love to hear from you about really what made you decide to become a pediatric nurse practitioner.
It was a really interesting journey. And I remember that I always wanted to work with children. And I had thought about public health and maternal and child health. I thought maybe I would become a teacher, elementary school. And I had a very interesting experience when I was in college. I studied abroad in London. And as part of being there, I traveled to Geneva, Switzerland, and had a chance to see the headquarters for the World Health Organization and also see the International Red Cross Museum. And I distinctly remember walking into the museum, and there was this beautiful exhibit about nursing and the impact that nursing had had around the world in so many places. And I was completely enamored by the stories and the exhibit. It's really touched me. And so I came back, during my senior year of college, and I volunteered at a hospital through NYU in New York. It's called the Healthcare Opportunities Program, where we got to shadow and learn about different healthcare professionals. And it was there that I shadowed a gentleman named Dr. Fred Epstein, who has since passed, but he was a pediatric neurosurgeon. And there was a nurse practitioner named Kelly O'Keefe Marcoux who was working with him. And she introduced me to the role. And I watched her work with pediatric oncology patients. She was one of the first to sort of develop that role in a hospital-based setting. And I just was inspired and really felt like it was a great match between my interest in science, wanting to work with kids, but then having this totally compassionate lens in the care that nurses provide. And so the interesting thing is that I went on and went to school and became a pediatric nurse practitioner. And it was years later at NAPNAP that I was reunited with Kelly. And she was teaching one of the courses that was there. And I went up to her and said, I'm not sure if you remember me, but I'm now a PNP and was largely inspired by you. So I think it was a really full circle moment and really spoke to how NAPNAP, the power that this organization has to bring people together and to have us find mentors along the way. So that was really fun.
Oh, Rashi, I love hearing that. And I have a similar story on how I found the PNP profession as well. But oh, that's amazing. Thank you so much. And so I'm wondering now that we have heard how you've discovered the PNP role, can you talk with us a little bit about your PNP education and career journey?
Definitely. Well, I grew up on the East Coast and did my bachelor's degree at Johns Hopkins in their School of Nursing, and then did my master's degree at the UCSF School of Nursing. And my nursing roles were really varied. I worked in federally qualified health centers, community hospitals, and then kind of got bit by the hospital bug and really enjoyed that acute care setting. And so was a nurse in pediatric cardiac ICU here at Stanford Children's. And so that was sort of where I came from. And then when I decided to take on my first nurse practitioner position, I joined a pediatric cardiology team. And so we were a team of advanced practice nurses caring for children with congenital heart disease or those children that had undergone a heart transplant. And I loved it. I loved the cardiac physiology. I loved the pre and the post of the surgical setting. And it was just so remarkable to see the trajectory of these children change as a result of the surgical procedures that we were doing. And so I love that. And I love that it was an exclusively advanced practice nursing led team. We ran the show there. I learned so much from those colleagues. And then I realized how much I loved surgery and wanted to expand my knowledge beyond just cardiac. And so I switched to a general surgery role and have since worked with them clinically. And that's been a really fun place in my career because I've been able to care for neonates through adolescence, care for different populations, oncology, trauma, congenital issues in our NICU, some bread and butter things that come in through our emergency rooms. And so that's been really great. And I've been able to develop more of an inpatient role for general surgery and be a part of some of the subspecialty clinics that we've learned that we need to develop to meet the needs of these kids. So that's sort of been my clinical trajectory. And I would say starting in about 2016 is when I started to do more leadership roles, not just here at NAPNAP, but also, professionally. And so served as the first manager for the APPs in our medical service lines, served as interim director at our hospital, and now more recently have shifted into a role supporting professional development. So for all of our advanced practice providers, no matter their area of pediatric practice, what can I do to support their professional growth and development at a local level at our institution? So that's been great. And I just feel very lucky that nursing affords us all these avenues that, again, I wouldn't have known I would have had the chance to pursue early on, and have been able to do.
Isn't that a testament to the nursing profession and the NP profession for that matter, that it's there to follow you and provide all of these different opportunities and paths that you maybe wouldn't have seen for yourself. So thank you for that. I'm wondering now if you can share with us, what was your journey to the NAPNAP presidency?
It was a very organic journey. Remember being a student and many of my faculty saying what a wonderful organization NAPNAP was. And so I got involved very early on as a student, serving locally on our local San Francisco Bay Area chapter, and just loving that I could step into a room and have a community of other pediatric advanced practice nurses that got it and understood, and I could just immediately join in conversation with. And so got involved locally with our chapter and served as our policy chair and then our president of our chapter. And then NAPNAP offered this wonderful program, the NAPNAP Advocacy Scholars Program, to go to Washington and meet with legislators. And so I was selected for that program. And it was there that I met Dr. Teresa Zielinski, my dear friend and colleague, who inspired me to consider, looking at other leadership avenues with the board. And so I was very grateful to serve from 2010 to 14 as our chapter's chair, which was great because I was able to network with all of these incredible leaders around the country and help support the work that they were doing with all their chapters. I had the opportunity to serve as health policy chair, and again, just continue to develop my understanding and love for children's health advocacy, and was honored when I was asked to submit my name to be president. So it really started at a local level, putting my name out there, and just getting to meet and network with a lot of people who really supported me.
I've done several of these interviews, and I'm hearing a recurring theme, and that is that none of us set out thinking that they would assume the presidency, but when the opportunity arose, they went ahead and made the leap. So thank you for that.
Yeah, absolutely.
I'm wondering if we may shift gears a little bit to your presidential term, and if there is a particular issue that was the utmost importance for the PNP profession and or NAPNAP during your presidency.
Definitely. Well, I served as president from 2019 to 2020, and so served during the time of the onset of the COVID-19 pandemic. And there are two things that I remember a lot about that time, but also preceding that time, which was when I first started the presidency, I was tasked with leading a group to develop our next strategic plan, which we called Blueprint 2020. And that was a very interesting process because we tried to gather data from a number of avenues. We talked with members about their needs in their clinical practices or school settings or research practice, wherever they were. We tried to engage with key stakeholders that work closely with NAPNAP to understand what they're forecasting their needs to be. We talked with our SIG and chapter leaders, and we really tried to scour the literature and understand what was happening in child health. And we pulled all of that rich data together to develop the strategic plan. And I was so proud of the task force that worked on this. And this all got put together toward the end of 2019. And I remember we launched the plan in early 2020. And the plan sort of fell into these four buckets, looking at external work, how are we as an association promoting outreach of the work that we do, as well as just the efforts that we were going to do to support, of course, child health and wellness. And then there was this internal bucket of work related to membership engagement and how we were going to continue to grow and diversify our membership and really continue to support the infrastructure of the organization. Of course, not knowing that in putting this all together, that this pandemic was on our heels and about to happen. And so in many ways, I think going through the steps of building the strategic plan and its steadfast true through that time, I think was very telling to how important both of those things were, how we could support our members and the structure of our organization during this onset of the pandemic, but then also how we could partner and understand and work with our colleagues. So the strategic planning is definitely something that stands out to me. And then obviously in March 2020, we were hit with this extraordinary public health crisis. And, I think the things that I remember early on were just the rapid shift and pivoting to how we were going to work as an organization, how we were going to communicate with our members, how were we going to communicate with one another as a board and with our staff, all the while within the context of ensuring that the health and safety of our loved ones was we were paying attention to. So we were individually under a lot of stress. Professional organizations were being challenged in many ways, and we had to quickly pivot and really just be innovative and creative and also humble and just take each day as it came, as the information was changing around us. And I just I can't say enough about how extraordinarily proud I was of our board, of our staff, and of our members for really coming together and rallying and saying NAPNAP is so important to us, and we are going to stick through this and figure this out through the ups and downs, and every decision and everything we have to do, we're going to do it. And so we really tackled it head on. And I think what I remember of that time was just being really open and flexible and trying to think, what do we do? What do we do to keep our members engaged in the work? And how do we pivot to these virtual platforms to still offer that? And having those early discussions, which now almost seems like we're all in that space and we're all so much more used to it. But having gone through it in the early stages, it was very, very challenging. But we were so resilient through all of that. And it's been great to see how much has grown from all of those initial efforts to what we are able to offer now.
I think that was excellent. And COVID just changed everything. And I'm wondering if you want to expand any further on challenges specifically that the board was contending with during that time. Now, I say that with a smile because I served on the board during your presidency, but please go ahead and share what you recall.
Yeah, well, there are a few things. I think the first and probably one of the most impactful was making the decision to cancel our national conference. And as you know, that was a difficult discussion. It was, we thought about this from so many places, and we know that the conference was one of the most meaningful experiences that our organization puts together, and never in the history of NAPNAP had a conference ever been canceled. And we made that difficult decision. And so the board really had to come together to think about that. And as a result, then also thinking about how do we recover from that, and how do we not only just consider the virtual offerings that we can give, but financially, how do we recover from this and ensure that we remain solvent as an organization to carry our work forward. And so the board had done extraordinary work with our budget, with planning, and then working with our education team and conference planning team to have our first ever virtual conference. And when I really think about it, the turnaround between the decision to cancel the conference and then actually having our virtual conference happen was just a few months. It's really a Herculean effort when I think about it. And kudos to Laura Nelson and our education staff, our conference planning committee, the board, everyone who came together to support that to happen. I'm pretty confident that NAPNAP was one of the first organizations that I can remember that did that and did it successfully. And we had over 2,000 people and members attend that conference, which was amazing. And so those are a couple of things that I remember, amongst many other, challenging and difficult discussions we had. But I think the one thing that holds fast with NAPNAP are these members, and our executive board was just truly outstanding and resilient and hardworking and put in so much effort to work through these challenges. And we really benefited in the end from all of that time and effort.
I think you captured that beautifully. It was just this period of absolute uncertainty and rapid fire decision making. And I remember very clearly you saying this, Raji, we have to make the decision with the data that we have at the time. And you're so right. I'm exceptionally proud to see the way in which NAPNAP was able to weather that very difficult period. And I'm going to make a plug here, though, Rashi, that it was very much your leadership that allowed us to keep moving forward amidst all of that uncertainty and difficulty. So thank you for that. I'm wondering now if there is a particular healthcare topic or advocacy area that comes to mind that was really a priority during your presidency.
Yeah, there are two that come to mind. And one is before the pandemic, NAPNAP, our executive board decided in December, I believe it was 2019, to formulate a policy to sign on to amicus briefs. And this was something brand new that we had, again, exploring and thinking about creative ways to continue our advocacy efforts in a new channel that we hadn't done before. At the time of when I served as president, we were continuing to work through the health and well-being of immigrant children and families at the border and in these facilities. And so we had collaborated with the American Academy of Pediatrics on an amicus brief in the Flores versus Barr case. And the Flores settlement had been in place since the late 1990s, I believe, and really governed the way that children were treated in when they are in immigrant custody. And the board and our organization really took a look at this from a health and well-being lens. We understood the long-term and short-term consequences, negative health consequences of children potentially being separated from their families, not having access to basic needs, not least of which, of course, is basic healthcare needs, and not having to be prolonged in detainment for a period of time, knowing the health effects that could have. And so making that decision to sign on to this amicus brief to uphold the Flores settlement, in which we were successful in doing, was exciting. It was exciting to be a part of those discussions from a policy standpoint. It was exciting to explore that avenue. And it really opened the door for NAPNAP to have conversations with new agencies that we maybe hadn't briefed previously, whether that was legislators that serve on the Senate committees that relate to immigration and custody, whether it's working with international agencies in sort of supporting children that are in these areas where they need that help. It just kind of really opened this door to have conversations with new groups and entities and put ourselves out there as a leader in children's health and well-being and welfare. So I do remember that being a really significant policy issue during my presidency. And the other thing that I remember is that we had held our Capitol Hill Day in the fall in Washington, and we were talking with legislators about critical things like vaping and advertising to children regarding vaping on Title VIII nursing workforce reauthorization funding, which has always been a hot issue for us to continue to advocate for, Medicaid and CHIP access. And I remember at our fall meeting, Dr. Kristen Hiddle-Jigley and I, my colleague, presented on diversity in the workforce and understanding how we can continue to find ways to build diversity in our pediatric advanced practice nursing workforce to mirror the diversity of the children that we had. And as I finished my presidency, is when, unfortunately, we saw the death of Breonna Taylor and George Floyd, and then this entire sort of discussion resurgence around the effects of systemic racism on children. And so that was also equally a very important policy issue that came forward of how we wanted to respond to that, how we wanted to have this dialogue, how we wanted to better understand the impact that racism has on children. And that led to town hall discussions. It led to the more formal formation of a DE&I committee for our organization. It led to formal statements on the issue. And I know that work has continued since then. And so I think that those new avenues and discussions were two big policy areas that I remember came up during my presidency and continue to be areas that we focus on.
Do you ever stop and think, oh my goodness, look at everything that was going on during this term? I mean, it's really extraordinary, Raji, hearing you recall some of these things. I mean, joining that amicus brief really opened the door and pushed NAPNAP into this new realm of advocacy, and we've certainly continued that. But you're right, it started in your term. And now we're in this realm of advocacy where we're actually signing on with amicus briefs fairly regularly and quite successfully, I'll add. So that's so fascinating. And you also bring up the diversity work. And honestly, I think this is something that has emerged as one of the priorities for NAPNAP, and advocating for diversity and our commitment to really infuse that through everything that we do. So I guess on behalf of the association, thank you for leading that. Which then leads me to my next question. Although you've touched on many items that could fall within this question, I'm curious, were there any education, certification, or workforce issues that were shaping NAPNAP's decision-making during your term?
There were many, and obviously many related to the pandemic itself. But one issue that I think really stood out to me was related to the workforce. And part of that was, again, the relaunch of our white paper, looking at the critical shortage of PNPs that are predicted for our future. We had launched our student ambassador program to try and bring in students that are entering this profession to join us in this journey. Discussions more about diversity in the workforce and programs that can help support that. And I think for the first time during my presidency is when I really reflected upon thinking about 50 years from now, who is going to be caring for children, and what is that workforce going to look like, and what work do we have to do now to support a pipeline of practitioners that are really dedicated to caring for children. I think anyone who's a member of this organization never considered doing anything else. We always have a passion for caring for children. We see such value in doing that. And we also appreciate the unique skill set that's required to care for children, no matter your practice setting. And we're very passionate by that. So it's hard for me to believe that anyone wouldn't want to take care of children. But the reality is that we don't have as many folks choosing to come into pediatrics in whatever role that may look like for them. And so I think workforce development, diversity in the workforce, thinking about that pipeline were important. And I think during my presidency, NAPNAP really tried to get involved in national efforts that was looking at this at a higher level and partnering with other organizations and understanding this better, and trying to give us the right data and information to keep working in this space. So I think the workforce piece is important. And I think now that we're celebrating our 50th anniversary, it does make me think forecasting 50 years from now, and people are looking back and maybe watching this video or looking back at what we have accomplished in that time. It'll be really interesting to see where we are then and what our pediatric population looks like and the providers caring for those kiddos.
Well, this is wonderful. And you're right, that work really created the foundation upon which we have now built a lot of our efforts towards the workforce, which of course the pandemic has catalyzed the urgency around that work right now, because not only are we seeing the trends of fewer people entering pediatrics, but now that we're contending with burnout and such, that pipeline is really under threat. So yeah, wonderful, wonderful point there. I'm curious if you could share if there was a unifying issue that rallied PNPs and other NPs to join and support NAPNAP during your presidency.
Without question, it was this pandemic that comes to mind. I just was so amazed at, despite all the uncertainty and despite conference cancellation and despite just not knowing what was going to happen, everyone came together. I had received, I remember so many messages like, we know the board is working hard for us. We're going to get through this. We're here to support you. I mean, it just, everyone came up and said, we're going to do what we need to do to keep this organization going and to keep our members supported and to keep doing whatever we need to do to help children. And so without question, I think for better, for worse, the challenge of the pandemic, I think pushed us all to rally together and do what we needed to do. And I've been so impressed to see how the things like starting our first virtual town halls and now our podcasts and Team Peds Live and our Facebook Live events, our virtual conference offerings. I mean, those were all our first when I was finishing my presidency. Now they've really taken off and I think provide such great value to our members and in a unique way, in a very distinct way. So it's been really great to see. And I also think, again, sort of this issue of systemic racism really did rally people together. There was so much passion around this, around the world, of supporting this and understanding the fundamental issue that we're faced with, and examining our own biases and trying to find ways that we can just have open, honest dialogue about this and help one another to improve and hopefully try and start to eliminate some of the inequities that we see. So again, big issues, but ones that I think definitely rallied members together.
Well, and to follow up, you talked about so many first virtual conference, first podcast, and other things. And, an outcome of that is we had record-breaking participation. So NAPNAP's offerings were suddenly reaching more members, and we really increased our engagement there. And so what's so exciting is to see that those innovations have endured within NAPNAP. So some of these things that were new under your presidency, my hope is that they're really going to become sort of our norm moving forward.
Yeah, it'd be great.
So acknowledging that plenty of your presidency was focused on some crisis management, I want to give you the opportunity to share if you have a particularly memorable experience during your presidency that you would like to share.
Well, there are a few, and despite the challenges, there were many exciting moments for us. And I think one, that honestly comes to mind is I really do think back to all of our executive board meetings and discussions, and as hard as they were, I remember walking away from each one just being so grateful that this group of individuals and the staff and everyone that was rallying was there. They were the right people to be there to help us at that time. And so I think all of us learned together as leaders and grew in that time. And I very much remember that as such a positive and growth experience. I also really remember enjoying representing the organization at the American Academy of Pediatrics, at the Children's Hospital Association, the Nursing Organization Alliance, still putting our names out there and sharing our best practices of what we do as an organization to support child health. I remember. And the other moment that I remember was leading our first virtual business meeting because of the conference cancellation, and our first town hall. And that first town hall was to talk about the pandemic. And I remember we brought together primary care, acute care, academia, policy discussion. And it was the first time we were trying this sort of format. And I remember receiving a lot of great feedback from that discussion, just that we were all in it together. We were all open to hearing about everyone's lived experience of this pandemic and just understanding and appreciating what everyone was going through personally and professionally. And those moments, I think I'll always remember. Again, those first, I think, were great times to feel like you were doing something different and innovative. And to your point, hopefully something that would stick and be sustainable as a way to kind of keep our community going.
Thank you for that. I have to share something that's sort of silly, but it was the pandemic that actually catalyzed our adoption to transition to Zoom, because up until then, our board meetings were by conference call. So I can share that has been something that has endured. Having video or web conferencing has been a really nice change.
I remember the first time, I think it was Kathy Woodward on the board wanted to take a Zoom picture, and we were like, oh, right, we're supposed to do that now. So we can really show people we're all together. And again, these things now happen so regularly, but at the time, you're right, it was a real shift to how we just talked with each other. So yeah.
Well, that was something silly. So, Raji, I know that you are somewhat of a student of NAPNAP's history. It's something that you've been interested in for quite some time. So I'm curious, looking back on NAPNAP's first 50 years, there's something that stands out to you that you're especially proud of?
Yeah, as you know, I love quotes, and I was looking back and I saw a quote by Margaret Wheatley, educator and leader, and she had said, "There's no power for change greater than a community discovering what it cares about." And so I think that one of the things I'm most proud of looking back at our history are those founding members in 1973 who had the courage and determination to come together and say, we all care about children's health. We are a community of advanced practice nurses committed to working for children. We need to bring ourselves together because we know what we care about, and there's great power in that. And so I just think back to that group, and I would imagine almost if I were a person in that room, what would that feel like? How would you do that? And I just give so much kudos to them for coming together, forming this foundational organization, doing the first conference. Again, speaking of first at that time, I can't imagine the amount of work that that took. And now, knowing how much we've grown, not just in our membership, but in all of the work that we've done over the last 50 years, it's really because they had that idea for us to come together and do it. And so I think I'm most proud of knowing that that's part of our history and our legacy as an organization. And there's just so many numerous accomplishments in everything, in our policy work, in NAPNAP partners, in getting through this pandemic, and all of the virtual offerings we've done, and the networking and collaborations we've formed over the years. I mean, it's really extraordinary to kind of step back, and I'm so looking forward to celebrating that this year, and enjoying that and reflecting on that with everybody.
You're so right. And I call myself lucky that I've been able to speak with some of those founding members that were in the room when it happened. And, they are so humble in saying, well, we did what we had to do at the time. And we just stepped up and did what needed to be done. And what is so striking to me, Raji, is NAPNAP still holds true to those original ideals. We are champions for children. We are there to advocate for pediatric-focused NPs. We have created a professional home for our members and value and put forth some of the best continuing education available. And it's a pretty special legacy.
Absolutely. Absolutely.
Well, as we think about winding down, I have two final questions for you. The first is, what advice do you have for our emerging and future NAPNAP leaders?
Well, I would say there's so many things I think about, but I would say to our future and emerging leaders, be creative, be humble, be innovative. Don't be afraid to challenge the status quo. I think if there's anything we've learned over the last few years, it's that we can't just do things the way we've always done them. There's new ways to think about things. And as new challenges emerge, always go back to the vision and mission of this organization, and the core values that we stand by, and you'll never be steered wrong. And you'll always continue to do right by kids. And the other thing I would also say, again, just having gone through the presidency when I did, is document your process, write about what you've learned, the challenges and the opportunities, so that 50 years from now, our future leaders can look back and say, oh my gosh, what did our former leaders do, and what were they a part of, and how did they get through it? I think that is part of our story. It's part of our journey, and it helps us grow, knowing what we were able to do. So continuing to document and share and disseminate that work. And also have fun. I think we are so lucky to have an organization and a professional home like this, to feel like you're part of something so much bigger than yourself. And that's a very unique opportunity. So be grateful for that experience, and enjoy it, because it is really something special.
Thank you. Now, if you could go back in time to share some wisdom with your younger self, what might you share?
I would probably tell my younger self to have grace, have patience, that sort of settling into comfortable with being uncomfortable as things come up. That is part of the journey. And I tell myself that now too. But take advantage of, continue to take advantage, be a sponge, learn, see, do, talk, meet with others. Just take advantage of any opportunity that comes before you, because you never know in the end what that may lead to. And just as we're doing now, I would tell my younger self to take the intentional time to stop, reflect, take inventory of your strengths, take inventory of the challenges and what you've learned from them. Take the time to do that, so that you kind of recount your professional growth and journey along the way. And again, take care of yourself. And I say that to everyone. Continue to take care of yourself and find that balance. And always enjoy what you do, but make sure you take care of yourself well, so you can take care of others.
Very wise words. Any closing thoughts that you have for us, Raji, before I let you go?
I would say I again feel so honored to have been a part of leadership for this organization and continue to be part of NAPNAP. And I'm excited to celebrate our 50th anniversary and just really happy to be part of this community and look forward to hopefully seeing many of us at the national conference, if not at other times. So
Excellent. Thank you.